Hi, I'm Dr. Vinod Methel, consultant diabetologist from Navi Mumbai, and today I'll be speaking on type 2 diabetes. And a point which I'd like to highlight over here is, should we Indians be concerned about type 2 diabetes? So in the year 1990, the total number of diabetic patients in India was around 26 million. Now when we come to year 2016, the number of diabetic patients have now increased to around 72 million. And if you look at the different prevalences in the urban and rural areas, so in the urban areas the prevalence of diabetes is around 10 to 14%, whereas in the rural areas currently it's around 3 to 8%. Now this number 72 million is expected to double in the next 2 to 3 decades. So should that be a concern? And I would say definitely that is a big point of concern. The numbers are increasing day by day, and in this an important point which I would like to highlight in our scenario is that in the Western population the type 2 diabetes is usually seen after the age of 45, but in our country what it is seen that diabetes seem to be occurring a decade earlier. So we are seeing more and more patients in the age group of 30 and 35 coming to us with type 2 diabetes. So what does that imply? So we know that diabetes has got long-term chronic complications. So what is going to happen is that as the patients come at an earlier age, we will be seeing more and more patients with chronic complications of diabetes in future. More patients with heart problems, more patients with kidney problems, more patients with eye problems, all because of diabetes. So that is a big point of concern for us. Then we ask the question, why is it that diabetes is increasing so rapidly in our country? Are there any reasons which we can point out? So again, the different reasons which has been speculated is that first thing is that it's been found that Asians have an increased susceptibility to type 2 diabetes. So in short, we can say that we have genes which actually increases the risk of us getting diabetes in future. The second important thing which is happening in our country is the change in lifestyle. So when I talk of lifestyle is basically your diet and your exercise habit. So our dietary pattern is changing, especially after the liberalization with more income coming to families. What we have seen is that we are actually changing our diet from our traditional Indian diet, and we are moving more and more towards westernized diet. And in that also we are kind of incorporating the bad food habits into our diet. So in short what we are doing now is that we are consuming more of processed foods, more of fatty foods, more food which are more in oil, pizzas and burgers, etc., more of refined sugar. The second thing which is again which is related to a lifestyle again is the lack of physical activity which is happening now. So what is happening now is that we are doing less of exercise, and when we combine these two things together, a poor diet combined with lack of exercise, what we get is an increase in weight, and we know that weight is a very big risk factor for type 2 diabetes. So again in this we have the concept of a thin fat Indian, where externally we appear to be thin, but then we actually have fat in at the wrong places, especially in the tummy, and this fat is a very big risk factor for getting type 2 diabetes in future. So we know that we are at an increased risk of type 2 diabetes. The incidence of diabetes is increasing very rapidly. So the big point here is, can we do something about this? Can we do something so as to prevent, so as to reduce the prevalence of type 2 diabetes, so that we don't have more and more people in our country getting with diabetes? There are certain things which we can do, certainly. So first, the most important thing which we should be doing is checking our blood sugars quite frequently, especially people who are at an increased risk of getting type 2 diabetes. So who are the people who are at an increased risk of getting type 2 diabetes? So those people about the age of 30-35, those who have got a very strong family history of diabetes, those who are overweight, has got BMI more than 23, those females who have got an history of GDM in the past. GDM means ladies who have got diabetes during pregnancy, which actually is a marker that their risk of getting diabetes in future are very high. So these are the group of people who need to be checking their blood sugars quite frequently. And the another risk factor is people who have got pre-diabetes. What is pre-diabetes? Pre-diabetes, it's a stage where your blood sugars are not normal, but then it's not at a diabetic range. Now, pre-diabetes, it's a very important group of patients which we have, and this is actually a warning bell for these patients that their risk of getting diabetes in the future is very high, and it is a stage where they can do where they can take some action so that they don't get diabetes in future. So what are the things that they can do? Most important thing is that we know that overweight or obesity is a big risk factor for diabetes. So these people who are overweight, they should try to lose their weight, and it has been found that patients in such group who are able to lose around 7% of the total body weight, they can actually get the risk of getting diabetes down by 60%, which is a huge number. So overall, to summarize, we know that the risk of Indians are at a higher side of getting diabetes, and basically, so as to avoid getting diabetes in future, what they must be doing is first is adopting a very healthy lifestyle, which would include having a healthy meal pattern, try to avoid refined stuffs, cut down on the processed food, limit your intake of refined sugar. In general, have a healthy and a balanced diet, which actually is good for all patients, all diabetic patients. And the second thing which they have to incorporate in their life is physical activity. So the recommendation is that the patients who are at a risk of diabetes, who has got diabetes, they should be doing at least 30 minutes of physical activity in a day, 5 times in a week. So minimum of 30 minutes for 5 times in a week is quite good for such group of patients. So they should be doing that. So exercise combined with a healthy eating pattern and regular checking of your blood sugars is one important way where you can actually prevent getting diabetes in future, or you can detect your diabetes early and thereby taking all remedial actions so as to getting any major problems with diabetes. So I'd request everybody to be a bit more cautious, be a bit more careful regarding your diabetes. Take steps so that you don't get diabetes. And if you feel any symptoms, if you feel that you are getting diabetes, get yourself tested. Go to a healthcare physician and do whatever suggested by your doctor to take your diabetes in control. So to conclude, patients who are above the age of 35 who has got high risk of family history of diabetes, they should be testing their blood sugars at least once in a year so as to verify whether they have got diabetes or not. If you have any doubts regarding this, anything, you can always contact me in my clinic and get all your queries answered. Thank you.